The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Aisha Davis, and I'm the Director of Policy at the AIDS Foundation of Chicago. Welcome to our virtual Advocacy Day and our luncheon conversation on discrimination during the COVID-19 pandemic. Right now, what you're seeing on your screen is a quick poll. We encourage everyone to fill out the poll. The videos for all of our panelists, including myself, will be turned on after the poll is finished. So please take a moment to do that. We're going to give folks a little bit more time to join the conversation before we get it started. So I am happy that you're here with us, and I look forward to engaging you in this conversation soon. Also, as another heads up, if you look on the side panel, I apologize, I have a cat. She's been very vocal lately because I'm in the house so much. If you want to look at the side panel, there is a section labeled handouts. On that handout section, there is a list of talking points that folks might be interested in looking at either before we get the conversation started or at some point throughout the day. As a reminder, our virtual advocacy day is going to be happening all day. So this isn't the only opportunity for you to engage with us. So feel free to tap into that handout now as we are doing this poll and waiting to get started. Good afternoon, everybody. Oh, the camera's on and then off. Technology always coming back to bite us.
can't hear you.
We're back?
Now I can. I can hear you.
Here we go. You know what? They say millennials are supposed to be really good at technology. I am proving us wrong every day. So good afternoon again. Welcome to the AIDS Foundation of Chicago's Virtual Advocacy Day. Normally, our Advocacy Day would involve taking usually over 100 advocates down to Springfield to talk to folks about current issues that we're thinking about, planning around, and bills that we're trying to advance. Given the current pandemic, we are not doing that because we are trying to be safe and practice social distancing, especially because we are often working with communities that have been particularly impacted by this pandemic. So to get us started today, I'm going to share a little bit of information, and then I'm going to introduce our wonderful panelists, who I'm so happy to be talking to today. So as everyone knows, we are in the midst of a pandemic, and as this pandemic has kind of unfolded and shown us what our new reality is kind of looking like in this moment, the Department of Health and Human Services has released a lot of information, especially around folks living with HIV. So I wanted to share a little bit of information about that before we get the conversation started to kind of lay a little bit of a foundation to the conversation we're going to be having. So the Department of Health and Human Services, or HHS, released some interim guidance. The guidance reviews special considerations for people living with HIV and their healthcare providers here in the US regarding the COVID-19 pandemic. That information is available on their website, but the data is collected on an ongoing basis and has been rapidly evolving. I know that a lot of folks have probably heard that people living with HIV are particularly susceptible to experiencing some of the more severe impacts of COVID-19. So this is something that we've definitely been looking at AFC. The guidelines and guidance includes general information to consider. And people living with HIV, although they may experience more severe symptoms from COVID-19, people who have contracted COVID-19 while living with HIV have an excellent prognosis, and they should not be clinically managed any differently than any other person who's in the general population with COVID-19. And that includes when making medical care triage determinations. Something that we have noticed as we look at what's happening across the country as this pandemic unfolds is that some states and municipalities have turned to implementing guidance and regulations that would allow healthcare providers to either treat people living with HIV differently if they are also currently suffering from COVID-19. And we are absolutely against doing anything like that because it often would mean that people living with HIV would receive worse treatment or triage in a way that would prevent them from accessing the same amount of care as someone who's not living with HIV. And with that in mind, the Office of Civil Rights under HHS also released a bulletin to discuss this specific issue. The Office of Civil Rights under HHS enforces Section 1557 of the Affordable Care Act and Section 504 of the Rehabilitation Act, which prohibit discrimination on the basis of disability in HHS-funded healthcare programs or activities. That includes people living with HIV. And these laws, like other civil rights statutes that the Office of Civil Rights enforces, remain in effect during this pandemic. As such, people living with disabilities should not be denied medical care on the basis of stereotypes. And that's something that people living with HIV often have to contend with, the stigma that comes with being someone living with HIV. And so when people are conducting, and when I say people, I mean healthcare providers, are conducting assessments for quality of life or making judgments about someone's medical care or what their quote unquote relative worth is based on the presence or absence of a disability or based on their age. All of those decisions that are made, if they are advancing any kind of discrimination, those providers are still going to be held accountable for that behavior under the Office of Civil Rights with HHS. So I just wanted to go ahead and state that because this is a conversation about discrimination and the COVID-19 pandemic. But we also know that a lot of times when it comes to policy conversations like this, it's one thing to have the policy written down, it's another thing to have it enforced and see what that looks like. So let's turn our attention to Virtual Advocacy Day in Chicago and Illinois specifically. So generally, like I said, we would be in Springfield having this conversation with a bunch of people, mostly legislators. I actually don't know if we would have been able to talk to Ken and Jim today if we were having our Advocacy Day as planned. But with the COVID-19 pandemic, we transitioned to Virtual Advocacy Day because we understand that it is still critical that advocates meet with legislators, elected officials, and other lawmakers to discuss how the pandemic is impacting our communities. The disparities that we've noticed are that there are significant effects and impacts on Black and Latinx people living with or vulnerable to HIV. That is something that we've always been monitoring, but during this pandemic, it's kind of been an opportunity to shine a light on a conversation that we've been having behind the scenes, and it's becoming a little bit more predominant right now. The pandemic is also something like we're monitoring it in a way where I unfortunately am keeping up with the numbers of things. And just last night, we saw the statistics are still showing that Black and Latinx folks are dying at a rate higher and disproportionate to their population in the state of Illinois in general. The reports that we've seen make us concerned that this pandemic is going to affect Black and Latinx communities the same way that the HIV epidemic has affected those communities, in that we're disproportionately affected, and sometimes we don't receive access to the same kind of resources that are generally available to the public. Additionally, we're also thinking about this in the context of our Getting to Zero plan, which I'm sure that our two panelists are very aware of. And what we've noticed is that many of the temporary policies that we're seeing being put in place by Governor Pritzker and the federal administrations to mitigate the effects of COVID-19 run parallel to the policy recommendations that are found in our Getting to Zero Illinois plan. So for us, we're thinking about the ways that we can kind of utilize this moment where we're looking at ways to make resources more accessible and easier to access for people who not only might not have looked for these resources before, but also who are in more desperate need for them right now. And what we want to do is figure out the ways to make these recommendations not temporary just during the pandemic, but make them more permanent to make sure that we don't see something like this happening again. As you can see, my cat is behind me. If she chirps in the, ignore her. She feels like she's a family. So with all that groundwork laid, I'm going to go ahead and introduce our two panelists. Jim Bennett is the director of the Illinois Department of Human Rights. He was appointed under Governor J.B. Pritzker in January of 2019. As the director, he is responsible for overseeing the agency's primary goals to prohibit discrimination because of race, color, religion, sex, national origin, ancestry, citizenship status, age, marital status, physical or mental disability, and sexual orientation. Basically, Jim is the guy to go to if anyone discriminates against you for any reason. In addition, the department oversees charges of sexual harassment. Jim Bennett was a lead strategist in Lambda Legal Illinois and Iowa marriage campaigns and successfully fought Indiana's Religious Freedom Restoration Act and their discriminatory religious refusal laws. Ken Gunn, for more than 30 years, Ken has dedicated his career to public service, specifically civil rights law. On March 1st, 2020, Mayor Lori Lightfoot appointed Ken as the acting commissioner of the Chicago Commission on Human Relations, where he has served primarily as the first deputy commissioner since 1990. The commission serves as the city's civil rights agency responsible for investigating and adjudicating complaints of discrimination, providing assistance to hate crime victims, mediating race and ethnic tensions, and providing anti-bias trainings. As the acting commissioner, Ken is responsible for the management of the agency and serves as its primary spokesperson. He also provides legal counsel to the staff and board and helps craft civil rights litigation. Before becoming the the acting commissioner, Ken worked for the Office of the Cook County Public Guardian, where he represented abused and neglected children. He also worked with the Illinois Attorney General's office, where he assisted in the investigation and resolution of consumer fraud complaints. He's a graduate of the University of Illinois Champaign-Urbana, where he received his Bachelor of Arts degree in history and his law degree. So a fellow attorney, okay. So right now I'm going to give Jim and Ken a chance to do some opening statements and let us know what they've been doing during this pandemic. You all can.
And do you want to start?
Sure. Okay. I just want to say thank you to the AIDS Foundation, Aisha, for inviting me. And it's good to be with a partner like Jim. We've been fighting these same issues together for a while, and it's just good to have a partner like him. When I was first asked to give remarks on this topic, discrimination in the time of COVID-19, I couldn't help but reflect back on some of the things we've seen in our recent history and this history as a nation. COVID-19 has brought about fear and panic and uncertainty. And our history shows us that panic and fear draws out racism, homophobia, xenophobia, and all kinds of hate. Haters like white supremacists, they know it and they thrive on this. And they love that divide and conquer mentality. They believe if they can make everybody afraid of you, they can put you down and they can keep you down. And this is just what we saw that happened after September 11th, 2001, where there was so much hateful rhetoric out there against Arabs and Muslims, and anyone who looked Arab or Muslim was being attacked on the street. And what we're seeing today with COVID-19 is dangerously similar. The virus has given haters an excuse to scapegoat Asians primarily, but immigrants and even Jews as well. Since the first reported cases of the virus in Wuhan, China, Chinese Americans quickly caught the brunt of this discrimination. And because you know how we are, we're so quick to lump folks together, now most Asians are being ostracized and discriminated against. Immigrants too are being blamed for bringing the virus to America, which I find funny since we admit like 1 million immigrants to the country a year, but 93 million of us take trips overseas and come back home, and none of us are being blamed, but that's another story. And now for our safety, our president has decided to close the borders to keep all those immigrants out. But I suppose the haters decided, you know, since we're slamming Asians and we're slamming immigrants, we might as well slam the Jews too. So now we're seeing anti-Semitic posts on social media, which are truly trying to blame Jews for creating the virus and somehow profiting from it. So again, I've been doing this work for like 30 years, and you just have to ask, like, when does it stop? You know, it'll stop when we all speak up. It'll stop when we hold our elected leaders accountable and demand that they act responsibly. The spread of hate will stop when we step out of our comfort zones and we make serious efforts, long-term efforts to come out of our silos and work together. One thing I love, Mayor Lightfoot has been saying since day one, how historical racism in Chicago has created these disparities in every sector of our city: housing, employment, education, criminal justice, healthcare, and even the environment. Back in February, before the virus, became front page news for us here, she hosted the city's first ever poverty summit, where she talked about the urgency of these issues and these disparities, essentially to save our city. I mean, she could not have been more profound. Little did we know that COVID-19 would bring these disparities smack in our faces, particularly for Black people. And I know we hear the stats all day and every day, and we keep hoping they'll go down or at least they'll level off. But one thing that continues to stand out, as Aisha pointed out, you know, Blacks make up 30% of the population and 55% of the COVID deaths. This is staggering, and it's extremely scary, and it's taken an emotional toll on the Black community and the city as a whole. But it's how we respond to it that makes a difference. You know, at the commission, we monitor this in terms of hate crimes, community tensions, and discrimination complaints. Now, at this point, with all the rhetoric coming out of Washington and the hate being spewed on social media, we haven't seen a spike in hate crimes, and we haven't had any COVID-19 related hate crimes against Asians in Chicago. However, we have heard from our Asian partners in the community that they have seen a rise in hostility toward Asians. And this is raising a fear, you know, fear of being attacked and fear of becoming a victim. And nationally, we are aware of about 1,600 bias-related incidents against Asians. Some are hate crimes and some are not. We know at the commission that these bias incidents, which could be nasty insults, but everything not quite a hate crime, can lead to hate crimes. So we're working with a couple community organizations, Asians Advancing Justice and Chinese American Service League, to produce a hate crime awareness video for the Asian community. And hopefully that should be out, I want to say next week or maybe 2 weeks. In the Black community, the emotional toll has been related to this history of discrimination, which is evidenced by, as again, Aisha mentioned earlier, the lack of crucial community resources. Initially, for weeks, one of the issues has been the lack of available testing in neighborhoods. Well, when there's already a lack of health resources in a community, the problem becomes exacerbated when we have a crisis like this. Similarly, so many Blacks live in areas that are food deserts and have access to, less access to the basic necessities that we all rely on. And this adds to the stress. And of course, we have a history of discrimination in housing, employment, education, and lending policies, which have created poverty on the South and West Sides primarily. The governor and the mayor have shown us that staying home and staying safe is the only way we're going to weather this storm. But at the same time, we do understand that staying home and staying safe is more difficult when you live in substandard housing or overcrowded housing. And of course, sheltering the homeless is a challenge that impacts more people of color, including LGBT youth. And now we're even seeing domestic violence calls to the police are up 12%. And lastly, we have to be concerned about our young people who've grown up in a culture of gun violence. We're talking about young people who've seen their family and their friends being shot to death. So do we really think they're going to be scared of a virus or care about infecting anyone else? So many have lost hope and feel like they have nothing to lose. And we've seen it already with near physical confrontations with the police, trying to disperse crowds without using force. And then this recent house party video suggests how a lack of hope can lead to just risky decisions. But this is how a history of discrimination and disparities is playing out. The commission hasn't seen a discrimination in complaints due to COVID-19. For one, our office was closed, although we are accepting complaints online and through the mail and through fax. But we are getting our calls about employment and housing issues directly related to COVID-19. For example, we get calls from people who complain about their employer's decision as who can work from home and who can't. We hear about, why should I have to come to work when I know, my coworker, has been infected with the virus. I also took a call from a gentleman who argued that Black men shouldn't have to wear face masks because they might be racially profiled. But here, again, we've been alerted to housing discrimination occurring to workers in the service industry like wait staff, and that we have spoken out against. So clearly in a few short weeks, COVID-19 had exposed the disparities brought about by a history of racist policies in our country and our city. But I am encouraged with the direction we're headed in under Mayor Lightfoot and her leadership. I mean, we have our first Office of Equity and Racial Justice with our first Chief Equity Officer. As I mentioned, we had the Poverty Summit where health disparities affecting people of color was a major emphasis. We've also held the Invest Southwest Community Resource Fairs to help fast track resources in communities that have been neglected for many years. And then just this past week, the city launched this Racial Equity Rapid Response Team, which held virtual town hall meetings in Austin, Auburn, Gresham, and South Shore to identify existing conditions for immediate intervention. And we know when we close schools, many children won't eat. So one of the first things that was done was to make sure families could go to schools and pick up food. And during the crisis, feeding programs and homeless shelters have been expanded. And then lastly, just yesterday, the mayor announced a new program with Airbnb, I don't know if you heard about it, to provide emergency housing services for victims of domestic abuse. So some of these initiatives, as you mentioned, are certainly driven by the virus in the short term, but there are many long-term programs with some serious potential to make serious change in our city, and hopefully it'll help us in the long run. Thank you.
Thank you.
Ken and I share very many of the same experiences, so I'll try to tailor my my notes accordingly. First of all, I thank God that Governor Pritzker and Lori Lightfoot are our leaders at this time. Like, yeah. I can't imagine previous administrations handling this and centering equity and fairness at the very beginning of this crisis. And so, I had a chance to be with Mayor Lightfoot in February, and I remember one of the questions she got was, why isn't she up north? Because she was giving all these talks, in the South and West neighborhoods, and she's like, because when they see me on the South Side, it changes everything for them. And so to have a leader like that understood these issues, in fact got elected on them, was huge. And then for Governor Pritzker and Lieutenant Governor Stratton, who have and Ngazi, or Dr. Ezekiel, I should call her, from public health, that this was this is why she came into public health before ever knowing we would be dealing with this. And so for our state to have that kind of leadership now is, it's a gift. It's especially with this awful national administration. Um, we've had very similar experiences in the types of things we're seeing. To give you an idea of how the state is set up compared to the city, for Ken, they have both the investigations and the judges, so the remedy are together. In the state, we have the Department of Human Rights and then a Commission on Human Rights. So the department that I'm over, we are in fact investigators primarily, and so when there's a discrimination for all the protected classes, you come to us and we conduct an investigation and determine if there is substantial evidence to move forward, and you can go to the commission or you could take it to court for your remedy, and then that happens at the commission level. Some of the specific things that have gone in place since the COVID pandemic has begun, some are the key executive orders, and we can provide these too if you want links to larger ones for the participants today. There is Executive Order 16, which suspended the repossession of vehicles so that people could still get to where they needed to be, and if they have to get to work. And ideally, we want people to be able to take cars and automobiles if they can get to their place of employment. And then that also shows you some of the disparity, that if you need to take a train, when you look at the studies of just in Chicago of who's using buses and trains, we've seen a great decrease on the north side, but if you go to the west and south side, it's decreased, but not at the levels that we would want for social distancing. Executive Order 20, which was around public assistance. So it made it so that you could send in unsigned applications, and you could provide just by calling in and providing a voice. So there's a word that I can never pronounce, but it's like attestation or something like that. Attestation.
Attestation, you got it.
Yes. Well, you're a lawyer, so being able to do that. Executive Order 25 suspended wage deductions summons. So with the exception of domestic support, you could those opportunities for people to go after your wages is suspended as well. And then to me, one of the biggest things the state has done is and city, because they really did it in concert the entire time, was moving very quickly to get this stay-at-home work order in place, because that's the best way we can protect people. And so the most people we can get to be at home is great. And then the other things that Ken talked about as well was just expanding testing. So certainly on the south and west sides in Chicago, but also in Illinois, rural areas has been really important. And then the whole, we call it the Metro East area, but all of East St. Louis, which is on the Illinois side, and making sure we have expanded testing there and that we're able to cover that. And then the response to disparities for our department, the Department of Human Rights in Illinois led the development of medical guidance that would lead to making sure that to hospitals and to any healthcare providers, what the guidance is that the state expects in providing healthcare, so that there's not, if there needed to be, and if you remember, we really thought up until about 2 weeks ago that there would almost certainly have to be a rationing of healthcare services to get through this. We've watched everywhere else that we had seen this virus peak before us. So New York, Italy, throughout Europe, horrible decisions had to be made on who got ventilators, on who got equipment. So we put out guidance that's on our website, and it's also on Department of Public Health, Department of Aging, the Governor's Office, and Human Services. We all work together to put out guidance that reminded people of the protected classes, that they can't discriminate against those protected classes. There can't be an assumption that this life matters somehow more than another. Especially for the disabled community, access living, which, I would have to say the AIDS Foundation and our old employer, Lambda Legal, were very involved with in drafting and putting together standards that really became the framework for ours too, because it's already terrifying if you need healthcare, but to have to fear that that's going to be rationed. You know, right now, and you know, it's a great success story for Chicago and all of Illinois, is that we believe we successfully bent the curve enough or flattened it to make sure that we're not going to have to ration those resources. But these are things that we need to know, because by almost everyone's accounts, except for the White House, you know, we believe that this is going to be coming back again in fall, and it could even be stronger. And so, one, we want to do the right things now, but we also want to make sure that when we go into fall, that we have procedures and policies in place, and that we continue to refine them so that we're doing the right thing. And then in terms of our office, we've had very similar experiences to Ken. The cases we're getting tend to be more employment cases, so we find ourselves working with Department of Labor a lot to sort of sort it out. So we've seen cases such as maybe the husband is a grocer and his wife has a healthcare job like a nurse, and they're telling the husband that he can't come into the grocery store because they're afraid that his wife could be affected. Housing is a huge one where there's been talk of evictions where because they're afraid that someone could have the virus. So for healthcare providers like nurses being told that they can't be there, or that there's questionnaires, and that's something we saw covered both by the Chicago Reader and the Tribune recently, that talked about landlords giving questionnaires and using COVID as a potential opportunity to discriminate. So it's interesting, because I do believe there's good intent. And sometimes, so some of these questionnaires, or that we saw when they've come before us, are things like wanting to know who are the elderly in an apartment building, so that people know to check in on them. And so we're having to monitor those things very carefully. But in the way that we're interpreting the Human Rights Act, is that a disability is protected, and we see COVID as a disability. And also, if you're associated, so disability by association is also covered. So if you have someone that, just like that person who works in the grocery store whose wife may be a nurse, or could be affected, you know, that's a case. And then the resource that I would want to mention the most is the text service that we have, that if you text 55-2020 and you can type in whatever you need. So if you write talk or hablar for Latinos, then it will provide counselors, but you can also type in unemployment, you can type in food, you can type in shelter, and you're able to find those resources as well. And then for our office, we've been pretty successful at moving about 85% of our people home, and all of our services online. And so you're able to do things through you know, email and fax. Our fact-finding hearings and our mediation are being done virtually. But again, we're also trying to figure out, how do you provide a virtual hearing if someone doesn't have access to online services or things like that? So, you know, it's a constant, it constantly demands our attention.
Thank you so much. It's really helpful to always hear from the folks who are doing this work. I was going to say on the ground doing this work, but we're all in our homes doing this work. So we really appreciate all those efforts that are happening. And we've seen guidance from the city and the state, so we thank you too for that. But also we've seen guidance from other cities, counties, and states, as well as federal agencies, about discrimination that may come up as we respond to the COVID-19 pandemic. For many of the communities that have been hit the hardest, especially the Black and Latinx communities, concerns about discrimination in care stem from a distrust that a lot of systems that we're supposed to rely upon for protection of healthcare, like hospitals, clinics, and providers themselves, we haven't really seen it, or it hasn't been something that we've experienced a lot of positive or successful stories from. How can we address the underlying distrust of these systems and individuals within them in this moment of public health emergency, especially because we want people to seek care if they need it, and do so in the safest way possible? But if they are holding on to this like history of being discriminated against in treatment, or not finding success with reaching out. How do we assuage that?
Well, go ahead, Jim.
Oh, go ahead. Yeah, I'm fine.
Well, I was just going to suggest the first thing is to help these healthcare systems and hospitals, improve their communication and interaction with the community. One thing we've seen over the years so often is, systems sometimes think they know what people need, but they need to ask. They need to be involved. They need to have that relationship with them. And, some hospitals, some services are a little better at it than others, but we need to, really help them work on that. And then, it's kind of like a no-brainer, but improve your services. It's kind of like a good restaurant, right? You go to a good restaurant, you tell all your friends. If you go to a doctor's office and they're really good and they treat you right, you tell people. And it's the same thing when you have a negative experience. And trust me, I hear those, I can tell you HMO jokes forever, but yeah, I mean, those are the things, people need to work on. And then thirdly, the healthcare system needs to build a relationship with the community for ongoing connections, not just for this month or next month, but ongoing, so they can have that interaction and have that input from the community on a regular basis.
Yeah, I would definitely agree with that. I think you trust the people you know, and so I've been incredibly thankful to the Black Caucus. The Latino Caucus has done great work too, but I feel like the Black Caucus was out there very quickly with Representative Robinson Lamont leading the way and setting up town halls that were just very practical. That it would just go through like, this is the number you call, this is who you have to reach. The task force that the mayor has set up, I try to listen into almost all of them, or we certainly have staff on every single one, because the calls that come in tell you exactly where the community's at. If you need to know what the concerns are, just follow the chat on Facebook Live on any of those discussions, and you'll realize what the questions are that people are facing. I agreed, we have to hold our healthcare teams responsible. I know UIC, where my husband's at, he's the head of the ER there. So they had been working for years to develop a project they called Champions, which was almost like midwives that young people that they were getting jobs, but they were also going into their neighborhoods because they found that you're going to trust someone that you know in your neighborhood, and you're going to trust someone to come forward. So it's finding every one of those places that you can go to in the existing groups that are already in place, and to make sure that that they know about us. I should mention, we're working very closely with the Chicago Lawyers Committee on Civil Rights, and in part because our investigations, they take a while. It could take up to a year to conduct an investigation. We also do HUD and EEOC investigations, and so we know that in a lot of these cases we need a response fast. And so, it may be, the Chicago Lawyers Committee is just writing a very strongly worded letter to a landlord, letting them know what the law, or them letting them know what the law is. But in all of these cases, and I would think Ken is in the same place, if you feel you've been discriminated against, file with us. We'll let you know if you're not in the right place, or if you need to go to labor, or we'll work with you to do that. But we want these cases. We need to know what's happening and what's going on. And if and it helps us monitor trends, be able to see what's going to happen. I think one of the biggest concerns, I may be jumping ahead. Maybe I am jumping ahead. I'll let you ask your next question, Aisha.
No worries. Actually, before I jump into the next question, I just want to let all of our attendees know that if you have other questions that we are not addressing right now, feel free to enter them in the chat. It should be on the right side of your screen. We'll be sure to look at those and get to them after we get through the questions that we prepped for. And then we did have one question. If Jim could repeat the number that you mentioned texting for help. I can't remember off the top of my head. I was going to try, but I don't want to give people information.
It's 55 and then the year, 55 2020. And then you just type in talk. If you want a counselor, they'll immediately respond. Hablar, I keep saying it wrong, I'm so embarrassed. Hablar for the Latinx community or Latinx, or any word if you're focused, if it's an employment issue, type in unemployment. And then that automatically connects you to the state service that we have, which oftentimes is a referral to where you need to go.
Thank you. So Jim, at the end of your last answer, you were mentioning that a lot of the things that we're doing involve quick responses and trying to get rapid access to services. So one thing that we've been discussing internally is that many of the policy changes and protections that have happened as a result of the pandemic are also limited in their scope to only be effective during the pandemic. What, if any, opportunities are there to extend the increased access to resources beyond the declared end of the COVID-19 pandemic? And how can we stay engaged throughout this process?
That's right. So the interesting thing is that with the executive order, they last as long as the public emergency is in place, although this is a public emergency that we expect to be in place for quite a while. And then the other interesting thing about executive orders is that in most cases, what they do is they relax requirements. They don't build or create something new. So they're able to take down, but when one of the challenges or the things that we'll run into is we'll find like a challenge in a question on like labor law or things like that, and we're not able to create, or the governor isn't, with executive orders, and he's been very clear that he does not want to take advantage of this opportunity in sort of in going beyond what his limits are with our Constitution. But one, I think it would be only for the most ignorant of people would you not be able to see every problem that we've all known about as activists and advocates for years, exacerbated by this. This was not a surprise. This disparity, which we have not seen in other countries to the extent that we're seeing in America, comes from this original sin that this country was founded on. So this is an opportunity where we're educating people and they're understanding more than ever. You could never before have you made a clearer case for universal health care than to know that if I have health care and then you could be the richest person in the world and then you have someone coming in your house or someone that's working in your yard that doesn't have the same access you do, they're going to put you at risk and you could put them at risk. And so we are all in this together. So I have to believe that there's an opportunity to make change based on that. But the other thing, and every one of our organizations that has seen this, and if we haven't, then we're in trouble, and certainly the state has, is we have been extraordinarily creative in finding solutions that when I walked into this job a year ago, for example, one of the questions was, could we work from home, or could we be more flexible in terms of how we do things? We're like, maybe in 4 years, like this is going to be really complicated. We figured out a way to move our entire workforce home in 48 hours. And things like, do we really need this to be notarized? Does a complaint really need to be notarized to be able to go in? Do we need affidavits for these things? Can we do things by phone that we couldn't do before? You know, in our office, we were having people physically come in, and that was the default. You really needed to come into a place in Chicago, Springfield, or Marion, Illinois to be able to file a complaint. We're not going back. Like when we find solutions that can make things better, make the process faster, it works for everyone. And I would argue for the employer too. They don't want to have cases dragged out forever. They want to be able to hopefully find a solution, find a practice that's not discriminatory, and move on. So all of us owe it to the people of Illinois to make sure that we're not losing this entrepreneurial spirit that we've watched by force move through all of our agencies and make things happen faster and better.
Yeah, I was going to say it's a challenge for government, those of us in government, because we're closely monitored, of course, by the media. So I mean, you just think about a couple of years ago, just the thought of state employees working from home. Oh, no way. But like Jim says, this makes you look at systems and, okay, maybe this is the time to make those kind of changes. At our office, thank goodness, yeah, we do not require people to have to have their complaints signed by a notary. So that has helped the process. We're trying to get more and more things online and then more of our resources online. And it's been funny because I've basically forwarded my office calls from my office phone to my cell phone. I'm getting calls from the public all times of the day and from all over the place. And I'm not sure if I should take the call or not, but I had one right before I came on here, but that's good. But, things are going to change. And it's, it can be for the better. A lot of things are temporary. But I think particularly, some of the things Mayor Lightfoot is looking at is definitely long term, and to look to address those disparities that she's been talking about for a long time.
Thank you. Thank you both. So another thing we've been talking about is that the pandemic has the potential to present additional problems for communities that have been under-resourced and hit the hardest by the pandemic, because the losses will be greater and the recovery process will likely take a lot longer. What protections can city and state leaders start working on now to ensure that we don't see a ripple effect of harm from COVID-19 in these communities? And how can communities be either engaging with you or responsive to the work that you're doing to make sure that we're ready and in place when all of these changes happen?
Ken, do you want to start, or would you like me to?
Yeah, go ahead. Go ahead.
I think that's the $1 million question. I was hoping Ken would go first, but I think, I guess to look at it from two different lenses. When I look at it from the Department of Human Rights, to me, one of the greatest opportunities for discrimination is going to be when we start going back to work, and what we're seeing, and so. One of the pieces that we're working on is how do we proactively educate employers to make sure that when a workforce comes back, that it's like, hey, where did all the African Americans go that used to work here, or I know I had people with disabilities, and for why weren't they called back, and so I really believe that that most people want to do the right thing, and they need the information to do it, and we talked about panic a little bit earlier, or ignorance, and usually my definition of panic is when you search your brain for something and there's nothing there, and so I think it's become incumbent on us, one, to make sure that people are reminded of these laws, just like this guidance for medical treatment, that this is common sense all the time, and this is the law all the time. But we have to remind people that if we're going to be making really difficult choices, that they need to be done with the lens of fairness and equity across it. The other piece is I do believe there's a sense of common good right now. I mean, we're very fortunate that we have a mayor and governor that are mayor of Chicago, I should say, because I know Aisha, your work is statewide as well as my own. But we're on the same side on these issues, and we're moving forward together on these same issues. We've also seen in most cases a strong bipartisan support across the state, and so it's reminding people as we get back and working with the caucus and working with the different caucuses that represent the Blacks, the Latinos, the gays, the LGBT community, everyone, to keep these issues at the forefront, and as a state agency, we are your servants. We are the people that you turn to, and it's our responsibility to be responsive to the state, and just like your representative and senator, it's incumbent upon you to reach out to us and make us aware of these, and it's incumbent on us to respond.
And I think for us, a big piece of it will be education, especially when you've been doing the same work for so long. You just assume everybody knows about what we do. Everybody knows what the law says, what the protections are, but it's not necessarily the case. And so not only do we have to keep educating, but we have to repackage how we do it. That's one thing. I love to have interns at our office because most of us have been around for a while, so I need some young ideas, some fresh ideas. And they said, well, why don't you, use social media more? Why don't you put it on there? Like, oh, good idea. But we have to be able to meet people where they are and give them the information. And as Jim said, this is evolving. Now, the cases that we're going to get related to COVID-19 are going to be totally different than a lot of what we've seen. So we have to figure out how we're going to handle that. But again, part of what we really try to do is to go out and educate employers and the housing community before those complaints come. We don't want to say, we got a complaint against you. We want to keep those complaints from even happening. So as much as possible, we want to, produce some education materials and get them out there for them, particularly the smaller employers and the smaller landlords who, they aren't being advised by a team of attorneys. So we need to help them get that information.
Thank you. So specifically talking about people living with HIV, we know that the COVID-19 pandemic has caused a heightened concern around vulnerability, and kind of speaking of what you were mentioning earlier, Jim, about panic, because the pandemic has really brought us into a place that we've never been before. So when we're searching our minds to figure out how to respond to this, we have no clue. So for people living with HIV, what, if any, additional protections might be available for folks living with HIV through your offices? And is there a way for folks to connect with you? Well, I know that you mentioned like emailing, reaching out, making sure that folks know that you're there to listen. But are there any particular people they should reach out to or touch base with? I mean, always reach out to AFC. We'll touch base with Jim and Ken if you want us to. But what ways can folks be thinking about protections that are available for them if they are living with HIV?
People with HIV are protected, but the interesting thing that the HIV/AIDS community was focused on early on with COVID-19 is that there is no difference in how someone with HIV is responding to this virus than someone without HIV. And so I guess the key takeaway is they should not be treated any differently because there's nothing different about how they're going to respond. They're going to have, the vast majority are going to have successful recovery rates. If your T cell count is where you want it to be, then you're going to be all right. And so it's discrimination if you're looking at HIV or as a reason for providing some kind of different level of care. And so we outline that in our guidance. But I believe you referenced the Office of Civil Rights document that the feds put out, and I have to say I was pretty impressed by it. I'm always nervous, in anything, but I thought it was pretty positive. And then a group of national, I think it was 45 national agencies, healthcare groups, then came out with an analysis of that guidance and sort of interpreting what it meant, and that was really solid in what we based our work on. So all of the resources of our department are available. If someone felt discrimination based on HIV, they should approach us. And then also with education and training, similar that Ken has talked about, is getting the word out through all of those groups, which we've been working very hard at.
Okay, I would just add our ordinance also protects people with HIV and AIDS. So we don't have to create anything new. Protections are in place. As Jim mentioned earlier too, I like for folks to call. When they have questions, just call us. A lot of times people say, well, I didn't file that complaint because I didn't think it was going to go anywhere. Well, why don't you just call? We can talk you through it. And it may not be something that the commission will handle. It may be something for another department. And we, can make referrals and help people find the help that they need to get.
Thank you. So we know that people who belong to many demographic groups simultaneously often face additional hardships as a result of being in those different minority or protected groups, like you mentioned, Jim. And so as a result, they experience what's called multiple jeopardy, because the discrimination or oppression that they experience is not just based on one particular attribute that they possess. For Black and Latinx people who are living with HIV, undocumented people who are living with HIV, and Black, cis, and trans women living with HIV, this pandemic is even more difficult because there are barriers to resources and care, even with the increased relief and stimulus packages. Is there room for additional protections that would consider the way that multiple jeopardy is affecting people during the pandemic? Because we know that a lot of times the law doesn't allow for those multiple axes of discrimination to be combined. Is there any opportunity for that to exist, or a way to move forward in having those kinds of conversations?
Well, I mean, I'll start. I think under our ordinance, we cover 16 protected classes. And it's very rare that someone comes in and files under one. You know, usually if I get race and age, I get race and sex, I get race and source of income. So you can file under multiple protected classes. And then, you know, our investigations will try to uncover all we can based on each of those areas. So there is no barrier at all. And we may find, yes, there is discrimination in this one, but not the others. And it'll still go forward to a hearing, and the person can still receive damages.
Yeah, ours is the same, and we also cross-file cases. So if you brought us a housing case, we would file that. We would cross-file with HUD as well. And the important thing to recognize is Chicago and Illinois provide far more protections than is provided federally. So, you know, the Illinois Human Rights Act, without question, is the most comprehensive and strongest civil rights legislation or law in the country. And so, you know, as we look with a bit of trepidation towards the ruling that we keep expecting from the Supreme Court around Title VII for the trans and LGBT community, you're covered in Chicago, you're covered in Illinois. And so as painful as it is to watch our protections across almost every line be denigrated federally, the state and the city have moved in the complete opposite direction. We've expanded coverage, and we're working hard to make sure that we have good law in Illinois to protect folks. But it's, you know, to your question of is there a way to expand it? I think everything is evolving, and you know, we're going to go back. You know, the legislature is going to go back. We're going to put a budget together, which is going to be, I'm expecting a very painful budget. But the other thing is, I believe that I know without a doubt that this governor and that our mayor and that the vast majority of the legislative leadership we have across the state, and especially in Chicago, the priorities are in place, and it's up to groups like the AIDS Foundation of Chicago and the Shriver Center, which I've been working with very closely for years, many others, to hold us all accountable. I mean, to make sure that those priorities translate into good law.
Okay. Well, you both know that I have other questions to ask, but we have some questions coming through in the chat, and I want to definitely give some time to those. So we have a question about the digital divide, and whether there's anything being done to address the fact that some people don't have access to smartphones, computers, and the internet, and how to get those resources into the hands of the citizens who lack those means. And the other note that they added was that social media only works if these necessary tools are available.
Digital divide. I can't speak to all the different city programs out there, but I know there are a lot. There's different things through the Chicago Public School System, the library system, through the Mayor's Office for Business Affairs and Consumer Protection. They make available digital resources for small business entrepreneurs who may otherwise not have them. So there are a number of things in place right now that I'm aware of, but I'm sure there's a lot more.
Yeah, I'm not too familiar with that too, but I can find out. There was an initiative that began last year, in the 2019 General Assembly, that expanded rural coverage and is still working towards building access on the rural level, which has been huge as we've moved to this e-learning for students. I've seen efforts that tend to be more nonprofit than or sort of individual hospitals. Like, for example, University of Illinois has put iPads in all the hospitals so that any person that is in intensive care, on a ventilator, or they could just be at end of life and they're not able to have visitors. They have a program that's putting an iPad that stays with them 24/7, as opposed to having to move from patient to patient, so that anytime that family member wants to check in on their loved one, they can see them. Because to me the most tragic thing of all of this is the thought of family members dying alone. I recently lost both my parents, and the thought of not being able to be with them and to hold their hand or to have some connection in those final moments, I just can't think of anything more devastating. So there are programs in place that are starting to do those, and I'll look up and see what I can find. I'll get that back to you, Aisha, on it, because it's a great question, and a lot of people are wrestling with it, but I don't quite know what all has taken place. But I'm writing it down.
Thank you. I will say that we have talked about a number of different resources and ways to get in touch with our panelists. I'm going to be working with our communications department to make sure that the information that we're getting is getting out to folks who've registered and who are attending this conversation right now. So don't worry. I will make sure that all the resources that we discuss will be shared with everybody. So let me jump back into one of the questions that we had prepped for. In addition to the resources and care that is needed as a response to new cases of COVID-19, we're also seeing an increase in hate crimes against Asian immigrant and Asian American communities, not necessarily here in Chicago, but across the country. How can advocates work with your offices to either address or prevent these attacks?
I'll start. As I mentioned, we're working on a hate crime video presentation right now for the Asian community. We're always expanding our network of community organizations that we work with, and we'd love to work with more. Hopefully, this hate crime presentation is just one of many things we can do, and we specifically try to tailor what we do to the needs of the community. So if there's something, if there's a need an organization has, we're more than willing to try to work with them. We're hoping, again, to have this, we wanted to make it a webinar, but we decided, because there's so many different Asian languages, we decided to go ahead and tape it and have it translated, and then have it available to people online that way. So hopefully, this will, provide some basic education about hate crimes. And of course, like I said, we're always willing to come out and speak to people and, work with community organizations on this.
Yeah, agreed. We haven't had a case yet, although there have been some that we've learned about of people being intimidated on the L or yelled at or spit on, things like that. So I know Asian Human Services with a group called Hollaback, who I think do really good training. If anyone wants to look them up, and it's free, and this specific training I'm talking about, it was free and online through Asian Human Services and Hollaback, which was how to address it when you see it in public. So whether you're Asian yourself, or if you're an ally, or you're just on the train and you're seeing some fool do something hateful, just how it can be addressed and at different levels to make sure you stay safe but that you're also doing your best to put an end to it. And so I think that's really important. And I mean, yeah, and then if there is hate crime, certainly the Attorney General's office for anyone in the state of Illinois, you can contact them. They have a hate crimes hotline. You can contact our office. We'll get you in touch, and then the city that where Ken's shop also takes on the hate crimes directly as well.
Awesome. It's really great to know that there are some bystander intervention efforts being put out there.
It's very good. It's very good. They do really good LGBT work too. And the other one the training that I really like is through the Shriver Center, through their fellowship program, or their fellows program. Does really good work.
Awesome. So we did get a question from the chat about any specific asks to give to legislators. I don't know if our panelists want to add to this, but I know that we have some specific asks coming from AFC because it is our Advocacy Day. So one is to get in touch with your legislators about increasing the state funding for HIV treatment and prevention services, including HIV testing and PrEP. And if you don't know what PrEP is, pre-exposure prophylaxis. If you need more information about that, we can touch base outside of this webinar. And that specific ask is for a $2.1 million increase. Additionally, ask for new state funding to address the growing rates of STI diagnoses through screening and treatment. That is a $900,000 ask. And then increase in state funding to assist with emergency basic needs for people living with or vulnerable to HIV, with an emphasis on the Black and Latinx communities who have been disproportionately impacted by COVID-19. And that's a $57 million ask that we're putting out there for all of our legislators. So if you want that information, I'm sure that I can reach out to our folks to have that put into the chat box so that you don't have to try to remember all of that off the top of your head. I'm reading it myself, so I don't know off the top of my head either. And I missed one. There is an additional ask for $1 million increase in state funding to Black and Latinx-led community organizations to help weather the storm of COVID-19, because we know a lot of those organizations do not receive the same level of resources and funding. So definitely reach out to your legislators about that. We'll make sure that this information is shared with you if you want to make any calls. We're doing legislator calls this afternoon. So we'll make sure that you have all of that at your fingertips. We have another question that came through. Let me make sure I get the whole thing. This one is a question about communication and outreach. And the person wants to know, how have elected officials and other appointed folks been most responsive to advocacy communication efforts? And for example, what social media platforms have been used the most? I know that you all mentioned Facebook and Instagram, but are those the asks that, are those the platforms that you're using the most?
Okay. I think it depends on, who you are and what you use. Like, I'm older, I probably use Facebook more. I like Twitter. I've really used Twitter a lot more lately because you can search based on the specific topic or word, or if I'm concerned about a specific issue or even a bill that's moving, I can find all of the sort of discussion around that, which makes it a little bit easier. And then a lot of it depends on the rep or senator, but there's nothing more effective. It starts in person, but not anymore. And then it's a call, to get them on the phone and to talk to them. And I find, at least, I'm very fortunate to have Heather Staines and Kelly Cassidy as my rep and senator. They're very responsive. But we have a good group of people, and your organization knows very well how to put your energy and power behind you into good legislation.
Well, the city, the mayor, of course, uses Twitter a lot, and they have Facebook pages and all this other. For the commission, I have to admit, I'm one of those people, I avoided Facebook for years. My whole family's on it, everybody's on it, but I just refuse. Then our former Commissioner Noriega said, why don't we have Facebook? I said, okay, so now we have Facebook. And then just last year, we started Twitter, which I kind of like that. So I've been following the mayor a little bit on that. But, she has a team of folks who are great about getting information out there like every few minutes. They are really, really good, and they're on top of it. So we're trying to get there. But yeah, that's why I love interns, because they're good about that. So.
Yeah, everyone should follow the city and state human rights. We'll get information to you.
I was gonna say, as long as we're doing everything remotely, just make sure that the interns and folks know that they can access those things. And I'm sure that they will be happy to do a Facebook Live or an Instagram Live. I mean, if all these DJs can do Instagram Lives, why can't an intern from one of your offices do one, you know?
Right. I'm on House Party now. I love it.
Oh my goodness. See, we should have, I don't know how that would be monitored or anything, but that is hilarious. I wonder if there's like a human rights.
We'll just hang out ourselves, Aisha.
Exactly. So I had one more question that I wanted to make sure that we touched on before we really reach out and see if any other of the attendees have questions. Knowing that there are knowing that a lot of the discrepancies that we're seeing and talking about are the result of concerns that have been raised in many advocacy efforts. Jim, I know you and I've worked on advocacy efforts in the past, especially around the social determinants of health, and seeing that the guidance and attention from your department and commission. How can we work with your offices to keep these conversations going after the emergency has been declared over? We want to make sure that our advocates can touch base with you, talk to you about other concerns that they're seeing. I know that you mentioned calling, emailing, Facebook is a thing, even though Ken might not be as comfortable with it. But are there any ways to reach out to you, like through town halls, meetings, anything like that?
Well, so one of the so I guess the powers of the Department of Human Rights is that we're able to create advisory groups and have advisory meetings in communities. So prior to COVID-19, we were planning to do statewide town halls around the new harassment law, which has gone into effect and requires training statewide. And so for any topic, we could join together and host discussions and bring people together. One of the advantages I feel in working with the Department of Human Rights is we really are neutral. I mean, when we conduct these investigations, we do not put a finger on either side of the scale. And what we find is we work very hard to build common ground. So like when in the passing of the harassment law, which is really one of the most robust pieces of legislation I've seen in a long time, it literally mandates every employee to take harassment training this year by the end of 2020, is we wanted everyone together. So we worked with the Chamber of Commerce and we worked with employers and we worked with advocacy groups because, it honestly is better business to be not just diverse, but be more equitable and more fair. And people find, and that's the thing, when businesses really do the hard work of bringing diverse audiences together and giving them equal voices, and you're bringing all of that knowledge and that different perspective to bear, it improves their business, and time and time again we've learned that. So those are some of the ways you can work with us, and we'll go anywhere. I mean, honest to God, I can't think of any time we've turned down an opportunity to speak to someone. And then we have a training institute, which this will be my final plug, is we have a training institute that we have a new training director, Dr. Chris Smith. So I believe you know her, Aisha, and she joins us in middle May. I haven't put out the press release yet, so that's probably going to be a problem. But we
for the attendees.
Exactly. A little bit of information for the crowd here, but the Training Institute, we've moved all of our training virtually, and in fact, the numbers have gone way up because people have nowhere to go but to do training. So please go on our website because you'll find our whole list of training on every topic, and you can sign up in their video interactive classes. And then Chris is really going to take us to the next level. But we're ready to work with you.
Yeah, I would say for us, I think one of the things I think we're best at is helping build connections. So often I'll get a call about a specific problem, and kind of touching on discrimination and what we do, but maybe it's something for the Department of Housing, or maybe it's something for the Health Department, and we could make those introductions and work with you, to kind of build that first connection. Sometimes, we think we have to invent something, but it's already in place. It's just a matter of us reaching out and finding it and connecting the right people. But again, like Jim says, we're all over town. Wherever you need us, we come out, we speak, we'll meet you wherever we need to meet you.
In small groups, less than 10 people each.
That's
Yes.
right.
We'll meet you virtually.
Small groups and at least 6 feet apart from each other.
That's right.
We did get another question in the chat box about HIV decriminalization. And I'm actually going to tweak this question a little bit because it kind of brings up something that we've noticed in our conversations at AFC lately, which is that there have been some moves towards either sharing people's COVID-19 status with people, whether in public health areas or not, or like you mentioned earlier about having questionnaires going out to ask people about their exposure risk or whether they've been diagnosed with COVID-19. I know that that is another concern that we've talked about a lot at AFC, just around the ways that disclosure of HIV status has really resulted in a lot of discrimination that people have felt over not just like the past few years, but over decades since the HIV epidemic began. So has there been any conversation in your offices about ways to kind of protect folks? And have there been any conversations recently around HIV decriminalization in either of your offices? I know it's different at the state and the city level, just because the law will have to come, the change in law has to come from the state level. But I do think that there have been conversations with our Cook County Attorney General around whether cases are being brought under the HIV criminalization law. And I know this is something we didn't prep for, but any information that you both have on either HIV decriminalization or protections for folks who may have tested positive for COVID-19 who don't necessarily want that to be, that information to be distributed to others.
It's interesting. Because I was talking to some of our legal folks about, COVID-19. Of course, we have not had a case yet. Right now, the thing about it, we cover disability, right? But the way we define disability is something permanent. So, if somebody, if you, HIV, for instance, is covered, right? But with COVID-19, you could be well in 2 weeks, right? Or a month, or however long it takes. So I don't think we would necessarily take a case under disability. At the same time, we got to figure out a way to, again, educate employers and housing providers about turning folks away. So it's something we're gonna have to grapple with and figure it out.
And hopefully I'm not echoing. My speakers went out, so now I'm on my computer. We disagree a little bit, Ken, on interpretation of the Disability Act, although it's certainly up for debate. But because we don't know yet, we just don't know enough about this virus yet. So now we're hearing things about damage to the heart, damage neurologically into the brain. So we're not positive that you completely recover from this, or what the circumstances are. So our position is we're treating it as a disability, and we'll see how that goes and how it proceeds. Where it's a novel virus, it's a novel times, and so how we're going to look at it. But cancer is considered covered under the Disability Act, and you can recover from cancer. So we're not quite sure, but we're taking the most sort of the largest view that this would be covered under our purview and as a protected act. To your question of whether or not you should be obligated to reveal, or should this be revealed, we're struggling with that. And so I don't have a good answer. Because you're balancing privacy rights with a community's public health concern, and I don't know quite where that falls. And so I always would put privacy first, and so I believe it's reasonable to assume that you're protected, but we're just going to be dealing with these challenges, and we're going to have to figure them out as we go. Is it appropriate to take a temperature of someone when they walk into a building? I would argue yes, it's helping protect people, and often with this virus, people don't even realize they're sick for a while, and they're still able to spread it. So I don't think we have a really good or clear answer yet, but it's obviously a very good question because it's something we're definitely grappling with.
I'm taking notes too. There's a lot of following up.
Yeah, I was gonna say, I think that you brought up a really important thing, Jim, which is that we're still learning about this entire virus, what the pandemic will look like. It's not just about all of the concerns around resources and economic issues that are coming out because of the pandemic, but it's also just about how do we care for people? What does that care look like, and what care needs might arise for folks who have either survived COVID-19 or people who might be at higher risk of exposure. So I think it's fair to say that we're still thinking about it and figuring it out. And I'm trying to prevent my cat from getting on the screen. We have about 10 minutes left, so I encourage folks to keep asking questions. I actually do have one more question that I kind of thought of while we were all talking about that last answer. One thing that we know has been the hardest to overcome when talking about HIV and discrimination is stigma, right? Like, stigma is something that we can't really legislate around. We can't really put a specific ask on it. It's something that has to kind of develop through advocacy and education. So when we're thinking about COVID-19 and how this pandemic is looking and how it's starting to affect communities, we're wondering about what stigma looks like in relation to COVID-19. You know, is there going to be any point in time where people are going to say, well, if you recover from COVID-19, we don't know what that looks like, so we're not going to allow you to do this thing. We won't allow you to do this job because we don't know what the neurological impact is. We won't allow you to, I don't know, receive this service because we don't know what the impact on your heart is long term. How would you suggest that we kind of cut off the stigma now before it gets exacerbated? What ways can we talk about this pandemic to make sure that we're not seeing this decades-long stigma issue that we're seeing with the efforts to end the HIV epidemic that we've really been fighting an uphill battle on?
I can take a quick stab and then I'll pass it to Ken for hopefully a better answer. I think the interesting thing is that this is not like HIV/AIDS in the sense that, you know, when I was coming out and the stigma began as a gay disease, and you felt like if you weren't gay, you weren't going to get it. The chance this disease spreads so easily and so fast. And so, for example, one of the conversations I was having with Representative Ma, who's a very good advocate for many communities, but especially the Asian community and people with disabilities, others, is we were seeing 3 weeks ago people being sort of attacked, if not verbally, for wearing face masks. Well, you're not doing that now. Now there's a little bit here and there, like, you know, depending on who you're around. But part of it is this disease is spreading so quickly. So much of our population has it now and is going to be getting it, that it's very hard to create a stigma. You know, when you see these fool rioters that are out, like, because they, you know, in front of some state houses, and then 2 weeks later, we can be certain that there's going to be a number of infections because of their action. But there's no question that there's an awareness of it, and so part of it is going to be just being vigilant that when we see attacks on people, that we call them out, that we learn how to call them out as individuals, as fellow community people. You know, I keep telling my brother, who's a security guard in Springfield, and he feels funny wearing his mask, and I'm like, you're doing the right thing, you know. So ask them why they're willing to put other people at risk. That's what I wish someone would have said to Vice President Pence yesterday. Like, you know, how much do you value these healthcare workers and these patients that you're visiting if you're not even willing to put on a mask and protect them from you? So I think that we have to take the proactive stand of standing up both for people that have it, because there's not one of us in this country that's not going to be directly impacted, that's not going to lose someone we love, or watch someone really struggle with a serious illness.
Yeah, and I think to follow up on that, again, with the law, it's evolving. We're not sure where it's going to head with this, but it would be good to be proactive and, you know, start talking to folks about these potential problems and try to, cut them off before they start. And in the, in employment and in housing and in places of public accommodation. That's scary right in and of itself. If they're just going to start thinking, I'm just going to exclude whole groups of people, from my establishment. So yeah, we've got to reach out and start doing some education.
Thank
but
you.
we have to take some time to learn it ourselves. So.
Yeah, that I think is the hardest part, because this, like you both said, this is a very new virus. It's something that we have never seen before. So I think a lot of it is us trying to learn and act at the same time, which we know can mean that we're being responsive to the information we have at the moment, and that we have to be nimble and pivot when we get more information about something. It looks like we've answered all the questions in the chat. So because we have just a couple more minutes left, I'll let you both give us any closing remarks that you have, or touch on anything that we didn't get a chance to cover in the conversation.
No, the main thing, again, and I brought it up before, is, people should not be afraid of, the idea of filing a discrimination complaint with either of our agencies. Just go ahead and reach out to us, and we'll help you filter through it. It may be something we can help you with, or not. We'll help you find, the help you need with the right agency. But just don't sit there in silence and then maybe a year later say, I should have filed that complaint. I should have called somebody. Just go ahead and do it. It's okay.
That's great advice. Just let us know. I would say, the Illinois COVID webpage has resources that go, far beyond any one of our agencies or departments, and so I would encourage people to go to that. And the Department of Human Rights, our website is pretty up to date, and we have, it opens with an FAQ both on how to access our services now, how to get to our training, and then by the end of today, we'll have that key FAQ in Spanish, as well as the most common questions we're getting, whether or not they end up being with our department. A lot of them are labor related, but that's a good place to start, at least getting an initial thing, and supporting groups like the AIDS Foundation of Chicago for bringing us together to be able to tell our story. I can't thank you enough.
Thank you so much. Actually, now it's my turn to thank you both. I really appreciate you both making time. I know that we're in the midst of a very serious emergency, and you both have talked about all the work that you've been doing so far. I really want to go ahead and commend your offices for not only being willing to hear from people and help people get over that initial, do I have a claim, or should I even talk about this question, but also doing the things to put in place all of the structure that we need to navigate these systems. We're in a very scary time, and I think that your offices are doing what you can to help us out. So thank you so much for taking time out of your, I'm sure, very busy days to speak with us. Thank you so much to all the attendees, for the folks who gave us questions and who didn't. I hope that this is a conversation that has helped you, that you stay engaged with us, not only for Virtual Advocacy Day, but as we continue to go on and figure out ways to make sure that our communities have the resources that they need to get through the COVID-19 pandemic and beyond. If you want to hear more about these types of conversations, please stay engaged with the AIDS Foundation of Chicago. We have a Facebook page, an Instagram page, and you can sign up for our P2A service, which will text you if you don't like social media, and provide you information on how to not only reach out to your elected officials, but to give you some toolkits and other resources that we've created at the AIDS Foundation of Chicago. We have another roundtable coming up this evening. We will be talking to some legislators as well as community activists at 6 o'clock. So if you haven't had a chance to register for that, feel free to do so. I look forward to not only seeing you all later at that roundtable, but having some ongoing conversations about the ways that we can continue to provide services to the community. Thank you again, Jim and Ken. We're finishing on time, which is something that I count as a win. And I look forward to staying in touch with your offices as we go forward.
Wonderful seeing you both.
Yep, you too.
Thank you.
Take care. Be
Thank
safe.
you.
All right.
Yep. Wash your hands.
Wash your hands. Bye, guys.
Bye-bye.